Hi, I'm Dr. Greg Castello, board certified family practice, and today we're going to talk part 1, antihypertensive or blood pressure medications and different types of blood pressure medicines. So there's about 5 different classes of drugs that we use commonly for blood pressure. They each have additional benefits, different side effects, and they work on different parts of the body. The first class of drug, my favorite, would be the ACE inhibitors, ARBs, ARBS, and direct renin inhibitors. These drugs work on the kidneys and the hormones the kidneys use to regulate blood pressure. Some common examples of these would be lisinopril and enalapril and captopril and Cozar. These are ACE inhibitors, ARBs, and direct renin inhibitors. The second class of drugs are beta blockers, very common as well. These are good for heart disease and other things. They work directly on the heart by slowing the heart rate and decreasing the contractility of the heart, which lowers the blood pressure. Common versions of beta blockers would be medicines like Coreg and Bistolic and Inderal and Toprol or metoprolol. The third class of drugs would be calcium channel blockers, of which there's dihydropyridine calcium channel blockers and non-dihydropyridine calcium channel blockers. These work by relaxing the blood vessels and slowing the heart rate. And some common examples would be cardizem or diltiazem and Norvasc or amlodipine. The fourth class of drugs would be the diuretics like Lasix and hydrochlorothiazide. These drugs help by helping your kidneys to excrete urine and lowering the volume of the blood circulation, like letting water out of a balloon to decrease the pressure in the blood vessels. The last group would be multiple different types of medications, but considered vasodilator medications. Each of these classes of drugs has secondary benefits and secondary potential side effects. So as an example, the ACE inhibitors are great if you're a diabetic. They help you protect yourself from kidney failure. So even if you have normal blood pressure, you should take an ACE inhibitor to protect your kidneys if you're diabetic. Potential downside would be cough. And if you had something called renal artery stenosis, that might make your kidneys worse. The beta blockers are great if you have heart disease or had a heart attack. It can protect you from having a second heart attack and dying. So a downside of a beta blocker might be if you have asthma, it might make your asthma worse. Calcium channel blockers are good if you have a heart condition that causes a rapid heart rate like atrial fibrillation, or if you have heart disease, they can protect you from having a heart attack. They can commonly cause constipation and leg swelling, so if you already have puffy legs, you probably want to avoid calcium channel blockers. Diuretics are great for blood pressure. They're inexpensive add-ons. They obviously are good if you have swelling of the legs or tend to retain fluid or are African American. If you don't drink enough water or you get dizzy easily or if you have gout, these might be medications to avoid. So all of the medications we have secondary benefits. They all have secondary potential side effects. If you have just high blood pressure and no other diseases or conditions and you're otherwise healthy, your doctor can literally spin the wheel and pick any of the antihypertensive medications to start you on and find you on one that's effective for you. Most of the medications have generic availability at this point, so they're inexpensive. Most of them are once a day, so they're easy to comply with. Most of them generally have low side effects. So when you start a blood pressure medicine with your doctor, or if you're on a blood pressure medicine, you want to ask them, what type of medication is it? How did you pick that medication? Are there other conditions I might have that I might be benefited by taking a different medication? And if I potentially have side effects, what might those be on that medication? Different people respond differently to different blood pressure medications. We call blood pressure generally essential hypertension. That means in the vast majority of people, we don't know what causes their high blood pressure. They just essentially have high blood pressure. And for that reason, different medications have different benefits. So it wouldn't be uncommon for you to start a medication and not have a good success with it and have to switch to another medication because your system's different than somebody else. So don't be frustrated if you end up on one or two different drugs before the doctor finds the right drug. Or if you start a drug and you have a side effect, it's not the end of the world. There are many other drugs that have different or don't have side effects that you could take. So part 1, general introduction to antihypertensives and separate issues. We're going to do the specific antihypertensive medications and their classes and more detail on what their benefits and side effects might be. Dr. Castello, thanks.